Alrighty. Well, I'll hop into it. I got a couple questions or a couple comments from the audience that we'll go over real quick.
All right.
And then we'll kind of see where that leads. They're not related. So I'll start with first one is just a comment. Now, we did a video. It was just a short video of you talking about should you try to go back to work while your disability case is pending, and how you absolutely should try to go back to work if you think you can. And if you're able to maintain employment, then that will disqualify you from disability, but you'll also be working full time. So it's a win-win situation. And if you're not able to maintain employment and you try to go back to work, then that's pretty good evidence that you can't work because you actually tried to.
Yeah.
And
I'll use that
Yeah.
in my arguments for sure.
yeah, and we had someone comment on that says, yes, I've tried to work 3 different times and got fired from all because I couldn't do the work. I lasted around 3 months at each of them.
That's
Great example, right?
That's indicative of disability. Yeah.
Yeah. Yeah, I mean, if you try to go back to work and you literally get fired because you can't do the work due to your health condition,
Right.
that's like the best evidence, of all time.
Yeah, absolutely.
Yeah, so that's just a little side thing I wanted to put out there because someone actually commented on that. I like going over these questions and these comments from the audience because when we do a general podcast or we do a general video, I'm pretty sure it's going to help people out.
Right.
But when we're actually going over someone's comment, I'm sure it's going to help them out because they commented on it or they asked a question.
Answering a question.
Yeah. So hopefully we get more of those. Okay. Second question, the longer one that'll kind of lead into more of a conversation. This person says, I learned the term bureaucratic disentitlement this week. I would love for you all to possibly talk about why do they make people wait 2 years to get on Medicare? Because I came across a video on another channel this week that said basically SSA looks at this like an equation. You have people paying in and you have people dying off. And if you let the sickest people die off, essentially the ones that are no use to capitalism anymore, you have to pay out less. What is the justification for delaying the start of Medicare payments to fully approved claimants? I'm going to skip over the part about capitalism because that's a whole different podcast. But yeah, so I'll let you answer the actual question, but I'll go through what she's talking about here for anyone that doesn't know. So when you get approved for SSDI, this is only talking about SSDI. SSI has Medicaid, which is a different insurance program.
Right.
But when you get approved for SSDI, in addition to the monthly benefit, there is Medicare, which is health insurance that goes through the government. When you get approved, on the approval letter or on the notice of award, it'll tell you the date that you're entitled to benefits.
Right.
It'll say something like, you are entitled to monthly disability benefits beginning June 2025. Now, we're recording this in January, almost February of 2026. So if you got that letter, that would mean that you're entitled to Backpay because this is like 6 going on 7 months later. So they're going to pay you the monthly benefit, and then they're also going to pay you the 6 or 7 months of Backpay. But for the Medicare coverage, the health insurance coverage, that date that you become eligible or you become entitled to your disability benefit, that starts the clock for a 24-month waiting period before coverage starts for Medicare.
Yeah, and it's confusing because we use the term 24 months, and you were right. If they applied in June of 25 and got approved in, January or February, they're going to be entitled to back pay, but they're not going to be entitled to what would that be? It'd be 7 months. Mm-hmm. They're not going to be entitled to that because there are 2 waiting periods in SSDI. There is the financial waiting period, which is 5 months. So if they applied in June, they're not going to be paid for June, July, August, and September, and October. Yeah. So their back pay would be November and December and maybe January, but they're not going to be paid for the first 5-month waiting period. And then the 24-month wait for Medicare. Here's the kicker. The 24-month wait for Medicare starts when you're eligible for cash benefits. But you're not eligible for cash benefits with the first 5-month waiting period. So the Medicare waiting period is not 24 months, it's 29 months. A lot of people, kind of, don't understand that. And I will answer the question that was asked. Why do they do this? This, bureaucratic disentitlement. Why do they do this? 100%. It is to save money. 100%. The Medicare program costs, hundreds of billions. And so if they can keep you off of it for 29 months, actually, not 24, but 29 months, then that's what the government considers savings.
Yeah.
The 5-month waiting period. Well, why do they make people wait 5 months? Or they don't get paid for the first 5 months of their entitlement. Yeah, we found you disabled in June, but we're not going to pay you for June, July, August, September, and October. Why is that? It's 100% financial also. Well, we're not going to pay you that because it saves us money.
Yeah.
The representative community, we have been in discussions, and oftentimes heated discussions, with Social Security leadership. Even the commissioner, a few years back, we actually got more traction. And the discussion has been, stop this waiting period. You just got to stop it. It's just, people are sick and you're making them wait after they've been found disabled. It's, you got to stop this. And there are some politicians and there have been some commissioners who agree with that. But Congress wants these kinds of deals that we would make to be what they call, zero gain, zero loss. And so, okay, well, we'll stop the 5-month waiting period, but your benefits are going to be reduced. It's like, oh, well, wow, that's rotten, know. But that hasn't come up again probably in 3 years. About 3 years ago, we were like on the precipice. You'd give the claimant the option. You can just dispense with the 5-month waiting period, but your monthly check's going to be lower, and the monthly check's going to be lower forever, not for 5 months. It's going to be, if you were supposed to get $1,500 a month, you're probably going to get $1,350 a month forever. And what's happening is Social Security's like, once again, it saves us money. So there hasn't been any discussion, since. There are other matters that the new commissioner finds more pressing, but. So it's been discussed, but the bottom line is, they're financial decisions.
Yeah,
They're saving money by not paying you until, if they can make you wait several months to pay you, they save money. If they can wait over 2 years to, make you eligible or allow you to be eligible for Medicare, they're going to save money.
Yeah.
And also, keep in mind that Medicare has a monthly premium.
Yeah,
So,
after that 24 months, it's not even free.
Yeah, you got to pay a monthly premium.
Yeah.
It's reasonable. It's certainly a lot more reasonable than most health insurance, but it's not free. I mean, it's like it comes out of your check, and I think it's inching up towards $200 a month. It used to be like when I first started, I think it was like $110 a month or something like that. But it's inching up there. So that's not free. I think the next thing we need to talk about, though, even though it wasn't part of the question, is what about SSI people?
That's what I was going to ask.
Yeah. What about SSI people? Do they have a wait? Seeing that, let's say that they filed. Same thing. In June of 2025, Social Security finds that they were disabled in June of 2025. They got to wait 5 months? Nope. There is a wait, but it's not even really called a waiting period. Social Security, Supplemental Security Income, SSI. SSI becomes payable the first day of the month after you file. So if you applied on June the 5th, your benefits would start on July 1st.
Yeah.
And that goes for any time during the month. If you applied on June 25th, late in the month, well, your benefits will start June or July 1st. So it's the first day of the month following your filing date. That's not really even a wait, but it is when the benefits become due. However, your Medicaid or your state's equivalent, because some states have a different Medicaid kind of program, but Medicaid or your state's equivalent begins on your filing date. So if you filed on June 5th and you had a medical procedure on June the 10th, well, your check's not going to start till July 1st, but your Medicaid coverage is from your filing date. And if you hadn't paid that bill yet, which how would you pay it because you
Yep.
don't have any money, if you're found disabled as of your filing date, June 5th, and you had some kind of procedure on June the 10th, it's covered. Even retroactively, if it takes us until 7, 8, 10 months after you filed to win the case, if they agree that that's the filing date is when you were disabled, the Medicaid goes all the way back to that filing date.
Yeah, and that's a big plus to getting on disability benefits for either SSI or SSDI is the retroactive payment of medical bills. And I don't think a lot of people understand this,
Right.
like what all it encompasses. And I don't want to talk about, we're not health insurance agents, so like I don't want to talk about specifically what it covers and what they will pay for. But essentially, if you have, if you went through this whole disability process and you've been having to go to hospitals and you've racked up a bill with these hospitals, and then you get approved for benefits that covers that period, again, to an extent, I don't know if it's 100% or what the fine print is, but Medicaid and or Medicare will pay for that retroactively.
Yeah.
So that's a huge help because that could be tens of thousands of dollars or even more than that, depending on how long your case is and how much treatment you've gotten in that period.
Right. The representative community is absolutely loved by hospitals and large clinics because when we win a case, services that they had provided and charged for, but the claimant couldn't pay, all of a sudden, hey, we won their case, and then they call up and they said, by the way, my Medicaid, kicked in. Will that cover, the bill I had with you? Well, when does it start? Well, it starts on June the 5th. Well, you had the procedure on June the 10th. Yeah, we can file. And what they'll do is the hospital or the clinic will file with Medicaid, and they'll find out, they're eligible and it's paid. So you're right about, I don't want to go out on a limb and say how much they pay, but it's my understanding that a provider is bound by the usual and customary costs of a procedure or a hospitalization. And that usual and customary cost is dictated by, ladies and gentlemen, Medicare and Medicaid. And so, if the hospital says, you had this heart procedure and it's $90,000, and then you become eligible for coverage for that time period, the hospital might say, they racked up a $90,000 bill, and Medicaid or Medicare are going to say, but the usual and customary charge on that is, $50,000, and that's what we'll pay. And that will 99 times out of 100, zero out that bill. The hospital say, it's the usual and customary cost.
Okay, yeah, that makes sense. Well, let me hit you with a more complicated question. People can get approved for SSDI and SSI at the same time. And if they're within that within the Medicare waiting period, the 24 months, how does that work with, can you get Medicaid in the meantime?
Absolutely. That's a great question. And that is the answer. Yes, you can. For cash benefits, what's normally going to happen, because SSI, as you know, has this income and resource limit. And so if, let's say that you got that, you applied for both, and technically you're eligible for both. You don't have $2,000 in the bank. You don't have any monthly income that's, over the allowable limit. So you are technically eligible. Your case is approved, and you've applied for both titles, SSDI and SSI. And you're insured for SSDI. You've worked long enough to actually be insured. So your approval is going to be for both titles. The confusing part, and it is a complicated question because it's ridiculously confusing, that you applied for both. If you win, you're approved for both, But very quickly, your Title II benefits, 99 times out of 100, are going to make you disqualified from SSI, but the Medicaid part stays with you
Okay. Yeah.
until your Medicare kicks in. So it's kind of a complicated thing, but yeah, SSDI usually, because the monthly benefit amount is more because it's based on earnings and not
Yep.
that set rate that SSI is based on. It usually will be over the limit, allowable limit. So you get approved for both, and for a time, because there's that 5-month waiting period. Think about that. 5-month waiting period, they're not paying you for that. So how could you be disqualified
Yeah.
for SSI? So you'll get back pay for that from your SSI application, and then when your Title II SSDI benefits kick in, you might be ineligible for SSI,
Yeah.
but the Medicaid will have already kicked in also.
Probably the best way for clients to think about how that works with the SSI and other benefits offsetting it is just definitionally. I mean, supplemental security income.
Right.
It's not additional. A lot of people view it as you get SSDI or you get VA benefits or you get whatever other cash benefits, and then in addition you get SSI.
Yeah.
But you don't get anything additionally. It's supposed to supplement to a certain
Right.
amount of money.
Right.
For 2026, it's right under $1,000.
Right.
It might be $1,000, but I think it's right under
It's right under,
$1,000 for single individuals. Which means if you get approved for SSI and it's not reduced, then that's how much you get.
Right.
If you have income from other sources, they will reduce it because it's not supposed to just add on a benefit. It's supposed to supplement your income to get to a certain point.
Right.
The idea is a livable wage or something to
Sure.
help you out with that.
Well, let's say
Yeah.
that exactly. Let's say that you did work and you did make enough to be insured, but your job was a really low paying job,
Yeah.
maybe even a minimum wage job, and so your monthly benefit amount is like $600. Well, SSI is just shy of $1,000, so you're not going to get the $600 from SSDI and then the almost $1,000 from SSI. You're going to get the difference between the $600 from SSDI and what it would bring you up to the SSI amount.
Yeah.
And it is. It's
It'll supplement.
supplemental. Yeah.
It'll supplement the
Right.
rest. Yep.
Right.
Yeah, that's a good way to think about it. And then, so as far as going back to my question about receiving Medicaid in the waiting period, is that just a special provision specifically for people that are eligible for SSDI and SSI at the same time?
They won their disability case. Yeah.
Yeah. Okay. That's interesting.
Yeah. Absolutely.
All right. Well, last thing I want to touch on, let's take this opportunity to talk a little bit about Backpay and how far back they will go, and just a little bit more about the dates, because it's already confusing. Everything we've already talked about.
Oh, sure.
We're
It's
we're
very
doing
complicated.
we're doing our best to
Right.
speak precisely with this, but it's a complicated system. A lot of dates, a lot of provisions that only apply to specific programs that all sound the same. So with that being said, I'll use VA benefits as an example, as a contrast, right? VA benefits, they'll go back. Is there any amount of time that they'll cap out, or they just go, your back pay could be how many years?
A lot.
A lot.
I'm not sure what it is, but it's
Substantial.
A lot. Yeah.
SSDI doesn't do that.
No.
So break that down.
Yeah, so there are a few dates that you want to pay special attention to. For SSDI, you want to pay special attention to your AOD, which stands for Alleged Onset Date, and that is simply the date you became disabled.
Mm-hmm.
It might be the day you stopped working, but it may be the date that you had an episode, a CVA, a stroke, heart attack, a car accident. But the AOD, your alleged onset date, that's the date you're telling Social Security you became disabled. From the last time you worked, going 5 years into the future is the DLI, which is the date last insured. Also, this is only for SSDI. SSI doesn't have a date last insured because you're usually not insured if you're applying for SSI. But the alleged onset date is when you've told Social Security you became disabled, and if they agree with you, that will be your date of disability. However, they can only pay you 12 months prior to your filing date. So it gets complicated, but I'll be as simple as I can be.
We're doing our best here.
Yeah, so let's say that you became disabled on January the 1st of some year, and you waited a few months to see if you were going to get better, and you didn't. And so January 1st of the next year, you applied. And you say, well, I became disabled last January. Well, that's 12 months. And if they agree with you, if the medical records support it,
Mm-hmm.
then they will pay you, except for those 5 months, the waiting period. But they'll find you disabled as of January when you became disabled, even though you didn't apply until January of the next year. However, let's say that you became disabled 2 years ago, and for whatever reason you didn't apply until now. So,
Yep.
my onset date is 2024, but we're in 2026. But they're going to pay me back for 2024 if they find me disabled back then, right? Nope. Not just no, but never. They can only pay you back because of the way the law is written. The statute is they can only go back 12 months prior to your filing date. What's cool about that, though, is let's say you became disabled 2 years ago and they agree with you. So let's just back it up. January 2026 is when you filed. But January 2024, 2 years ago, is when you became disabled. They say, yeah, January of 2024 is when you became disabled. But you're like, okay, well, they can only pay 12 months. Well, they're going to pay you the full 12 months in this case, because if they find you disabled 2 years ago, that 5-month waiting period is sucked up in that. So they'll actually pay you from January of last year.
Mm-hmm.
So the waiting period, a lot of times when we have an onset date like that, we want to make sure that we get that 17 months. We want to make sure that the onset date's 17 months prior to the filing date. Why? Because 5 of that month is going to be waiting. You wouldn't be paid for it. But if we can say that you became disabled and the medical records support it, then your waiting period is not going to affect you the way it would some other person's waiting period where they applied a year or less ago.
Yeah, and so really 17 months, that is when you permanently stop, that's when you permanently start losing potential back pay.
That's right.
Because if you wait 12 months or 15 months or 17 months, and then you apply and you get approved, you're not really missing any back pay because we can go all the way back.
That's right.
But if you wait 18 months, you're still only going to get that 12. And then if it's 24 months or if it's 5 years, then you run into problems. If you wait too long, you might not be eligible at all. But
Right.
yeah, I talk to a lot of people that it's the same story as they stop working and then they just thought they were going to get better. It's like,
Right.
well, I didn't think I would be out of work this long. I thought I would get better. And now it's been 3 years.
Right, and the program has such a bad reputation that that's another reason that we hear, because it begs the question, you became disabled 3 years ago. Why are you just now contacting us to file a claim for you? Well, I thought I was going to get better. And I've heard that, it's just a horribly long, arduous process. It is horribly long and it is arduous, yeah. But you can lose benefits by waiting. When the people online or the people on TV say, you need to apply now, that's one of those rare instances where what they're saying is actually true.
Yeah.
So waiting, it's reasonable to wait to see if you're going to get better, or if you have a procedure coming up and you think that will correct something that that you're having a problem with, or you're mixing up medications, especially mental health. You see this a lot. Okay, we're going to try to find something that's going to help you be able to function better. You see that a lot in medical records for mental health disorders. And so you're very optimistic, and they're trying me on this and they're trying me on that. And they usually do that for about 3 months. It's not working. Okay, we'll try something else for 3 months. Mm-hmm. And, time gets away from you. And the next thing you know, I'm going to apply for disability, but I became disabled a couple of years ago. It can happen, and we see it every day. So, and I understand it, but if you're watching this, apply as quickly as you can. And we've talked about this before. If you apply and the medication does work, or if you apply and you do have a procedure, or you apply and just your body actually gets better, still heals yourself. and you just withdraw your case, no harm, no foul. Social Security doesn't hold that against you. It doesn't affect a disability case if you have to file it in the future. It doesn't affect your retirement. It doesn't affect anything. No harm, no foul. And we're not going to get mad about it. You know, hey, you know, I got better. I'd like to withdraw my case. Sorry that you spent so much time on the case. No harm, no foul. You know, so
We actually
better.
appreciate it if they're upfront with us.
Yeah, it's better to file and then say, well, I got better. You know, I'm able to work, than to just hope pie in the sky that you're going to be able to get better and you're going to be able to go back to work. And, you know, you wake up one morning and it's been 18 months and you're, you know, now you're against the clock losing benefits.
What's the actual term for the entitlement date? Not the onset date, but the date that you actually become eligible for cash benefits. Is it just called the entitlement date?
Yeah, it is.
Okay.
Yeah.
Well, I'm going to recap just to break this down. The AOD, I'm going to go over three things.
Okay.
The AOD is the alleged onset date.
Right.
That is the date that you're telling us as your representative and therefore Social Security that you became disabled and unable to work.
Correct.
On that date. The entitlement date, when you actually become eligible for benefits, is going to be 5 months after that, assuming that they approve you.
Correct.
Your DLI is your date last insured, and that is the date that you have to prove that you became disabled by that date for SSDI specifically.
Right.
Generally, when you stop working, you have 5 years. Your DLI is 5 years in the future, and so an example of when that would be a problem is if you've been out of work for. I'll put it this way. Say your date last insured is 2025, which means you have to prove that you became disabled before 2025.
That's right.
And then when you apply your AOD, you put your onset date. You're saying when I became disabled is 2026. If you're eligible for SSI, it's not a problem. We'll just help you with that part of the case. But if you're not eligible for SSI, you run into a real problem there because Social Security is saying in order for you to technically qualify, you have to prove you became disabled before that date in 2025. Yeah. And here you are saying that I didn't become disabled until 2026.
And you would literally be technically ineligible. Most of our technical ineligibility cases are Title 16 or SSI cases, but that's one of those cases. In fact, that's the main case that we see is, you know, well, yeah, you know, I can't work, you know, beyond, you know, January of 2026. Well, your DLI was, you know, in September of 2025. You're technically not eligible. You're outside that window, and that's I always call it a window because I think that helps. It's
the best way to put it.
It helps people see that, you know, at the beginning is when the window has opened, and the DLI, or the day you became insured or stopped working, is the beginning of that window, and then the DLI, the date last insured, is at usually 5 months or 5 years. Sometimes it's less than that, though, and I think there's some bad communication online about the DLI. It's not always 5 years. For example, if you didn't work steady or you didn't make a lot of money, if there are gaps in several quarters of your work, that you might have stopped working, you know, 2 years ago, and your DLI is 1 year ago. Mm-hmm. And that can happen. Wait a minute, that's not 5 years. Well, no, because if your earnings were sporadic or really low, your DLI can possibly not extend 5 years.
So really what we mean by that is if you worked consistently without any major gaps up until you stop working due to your health, then typically your date last insured is 5 years. Yeah. But really what it is you have to work 5 out of the past 10 years.
That's right.
It's not always 5 years after you stop working. It's really 5 out of the past 10 years. Yep. So if you've only worked 4 out of the past 10 years, even if it was, you know, you stopped working a couple years ago, 1 or 2 years ago, that would mess up your date last insured because it would only be 4 out of the past 10 years.
Absolutely.
Okay. That's a lot of acronyms. I think we'll end it there. I have compassion for people that get confused by this because I get confused by this, and because it's a lot of dates and terms and programs, but I think that breaks it down pretty well.
Good.
Cool. If you have a question about your disability case, drop it in the comment section below, and we will do our best to answer it in the next episode.